Hello again, everyone. My name is Mandy, and today I'm going to be discussing some important measures to stress to a postpartum woman to ensure that they will be successful at breastfeeding their newborn infant, whether it's their first child or they're on to their third, whichever. First and foremost, it's important to educate the mother that breast milk contains all the nutrients that their baby needs and helps to fight off any infection. Breast milk is also easily digested and efficiently used by the newborn's body. The newborn should be breastfed for the first 6 months of life and be introduced to complementary foods along with breastfeeding for up to a year. That kind of helps to ease the transition between the breast milk and going into the food and helping baby, to just stop breastfeeding. Another important factor that it's kind of crazy to say, but of course you still need to stress it because, some people just don't know, is that if a mother decides to breastfeed, she should not smoke or drink alcohol. When it comes to an infant breastfeeding, it's important to have proper positioning, latching on, sucking, and swallowing for successful breastfeeding to take place. So I'm going to talk about a little bit what happens about the mother's breasts when they give birth. So shortly after birth has taken place, high levels of estrogen and progesterone in the woman's body kind of stop suddenly, and the prolactin begins to stimulate glandular cells within the breast to secrete milk instead of colostrum. Oxytocin then makes milk eject from the alveoli to the nipple. So once the newborn begins to suck, it will result in a release of milk. One thing to note is that if there's a drop in the quality of stimulation, it can cause prolactin to decrease, which means a decrease in milk is being made. So that basically means the prolactin levels go up when the stimulation of the nipple increases and vice versa. One thing to note also is if there's no sucking present, the breast will no longer be engorged or produce milk within days of postpartum, the same as with a woman who chooses not to breastfeed. The most important factor to take place for a mother who chooses to breastfeed her newborn is skin-to-skin contact within that first hour. This is considered the gold standard for breastfeeding. Research has shown that newborn's instinct is to seek nourishment after birth, and they even do a movement known as the breast crawl, which kind of like the baby kind of moves their shoulders and their abdomen as if they're trying to go towards the breast. It's kind of a crazy instinct, but once you read into it, you're like, wow. And also I read that mom can help facilitate this, or even a nurse can help facilitate this breast crawl if the baby is having a hard time. It's important to teach mom to look for signs of readiness to breastfeed, such as the baby looking around or moving, whether their mouth is open, and also if it appears as if they're like searching for something, but they're like unsure obviously what it is, but it's for the breast. The mother should also let the baby release the breast by him or herself and then proceed to offer the second breast, because you're not sure really if the baby received the amount of milk they want or not. If the baby does not feed within the hour, the baby should be kept with the mother, and she should try again later. It's also important for mom to understand that this can happen occasionally and to not lose hope or feel that something is wrong. Just kind of give it time. Mother should also breastfeed on demand day and night for as long as the baby wants. And I read that's about like every 2 to 3 hours. It's important not to force the baby to take the breast, interrupt the feed, or give any other feeds or water, only if they're deemed like important, or use artificial teats or pacifiers. You also want to try not to give your baby any pacifiers or artificial nipples until he or she is good at latching onto your breast, which is usually around 3 to 4 weeks old. So the next thing I'm going to talk about is, one thing is like what to do if your baby will not latch on. So if your baby will not latch on or suckle within the first hour, as I said before, you want to keep the baby in the room still with you and try again later. You could express colostrum directly into the baby's mouth or give it by teaspoon or cup, and that can help stimulate your baby to seek the breast. Mother can also gently stroke the baby on their abdomen or their legs to help the baby wake and seek the breast. She can also hold the baby close and have lots of skin-to-skin contact. As I said before, that skin-to-skin is so important. Another thing to note is that the baby may be very sleepy for the next 24 hours. It's normal for babies to become very sleepy after their first feed, and putting your baby skin to skin on your chest can help them to waken and seek the breast for a feed. If sleepiness persists after the first day or so, you will need to wake your baby at least every 3 to 4 hours for a feed, or as I said before, probably every 2 to 3, depending. A lot of it also depends on your baby's weight. Of course, if your baby's smaller, then you would need to feed more often, and larger, it would be less often. Mom should also know correct positioning and attachment to initiate breastfeeding. This can include making sure the baby's head and body are in a straight line. You don't want to have the baby kind of like in an uncomfortable looking position. You also want to ensure that the baby's head is facing toward the breast and the nose is opposite her nipple. She also should hold the baby close to her body. For example, that skin-to-skin contact is going to be most beneficial. She should also support the baby's whole body and not just their neck and shoulders, kind of make sure that baby is being very supported and that they're in a comfortable position. Mom should also touch her baby's lips with her nipple and wait until the baby's mouth is open and move her baby quickly on her breast to help attach. That kind of is another thing, like helps with that newborn instinct to kind of just kick in and try for that baby crawl, or know that, hey, I gotta eat. Mom should also watch for signs of effective suckling, like slow, deep sucks and occasional pausing is normal. Mother should also practice rooming in, which is basically allows the mother and infants to remain together 24 hours a day. That kind of gets them into the groove of things and, keeps them nearby so that, say, baby's ready to eat, or hey, mom's ready to, give milk, then they're right there. It's going to happen. It's within easy reach. Lastly, mom should be educated on, like various breastfeeding support groups and be referred to them on discharge from the hospital. She could also be informed on lactation consultants, which can help provide more information on breastfeeding and tips or tricks. The support groups are a really good idea, I read, because, there may be a lot of other mothers out there dealing with the same issues, and you can get the advice from another mom on what worked for her exactly. Also, like I said, any tips or tricks. You'd be surprised at what's out there. There's various groups on social media like Facebook, Instagram, anything like that. So that's pretty much all I have on breastfeeding. And of course, most important is that skin to skin within 1 hour. Thank you.